Recording.
Good afternoon, everyone. Thank you for joining us with, I know, short notice to discuss some of the workforce challenges that we know you are facing, that you have been facing for as long as I've been at the association, and that have been exacerbated because of COVID. I just wanted to give you some background on kind of what's been happening behind the scenes with LeadingAge Virginia. And then I have the pleasure of introducing Megan Green, who's going to talk about what's happening at the state level. So, of course, since I came to LeadingAge Virginia 5 years ago, workforce has been one of our strategic initiatives. And we've really looked at it in terms of recruitment, retention, best practices, and supply and demand. And we have worked on lots and lots of initiatives and strategies to help you with your ongoing challenges. We knew going into COVID that we had a reputation challenge just being in the whole universe of long-term care. Your individual communities, I'm not implying they have reputation challenges, because I know that you are bedrocks in your local markets. But just we joke a lot that people don't go to school and say, I want to work in a nursing home or I want to work in assisted living when I graduate. And we know that's one of the strategies to change that perception. But we also know that the challenge has gotten even tougher. What with the way that our sector was portrayed in the media during the pandemic, what with the fact that many of our frontline staff have kids who are out of school and so have had to make decisions about whether they can come to work or whether they need to be home with their kids, what with the enhanced unemployment benefits that has not necessarily incentivized everybody to come back to work. I've heard from members who've said that they had, CNA positions open for 60 days, 12 positions, and had only 3 potential applicants who then didn't show up for the interviews. I know Dana sent out, or we sent out in our newsletter, an NBC 12 story highlighting Pinnacle Living, one of our members who has 2 locations here in Richmond, Hermitage, Richmond, and Cedarfield, who talked about the challenges that they're facing when it comes to finding new hires. Well, we took all that information and we convened a meeting a little over a week ago with our public policy committee, which is chaired by our board member, Tracy Jennings, and other members who had reached out to us about this issue, as well as our board. And we talked about, what legislative approaches, if any, we could take to help address these concerns. We talked about incentivizing people to return to work. We talked about additional funding to come to our members, and Dana will talk about that for a second, or in a few minutes. We talked about other challenges to recruitment, as well as what organizations should we be partnering with. We recently reached out to the Virginia Restaurant, Lodging, and Travel Association, as well as the Chamber of Commerce, the statewide Chamber of Commerce, of which we are a member. And people, and everybody's feeling it, right? So it's been remarkable to have conversations to hear about their strategies, what their members are challenged with, and how their members are addressing those challenges. Coming out of our meeting of the Public Policy Committee were a lot of ideas. But what was on the forefront of our mind was to set up a call with Megan Green. And we did that. And I'm so grateful that she is here today to talk about what they're working on at the governor's office. Megan is a special assistant in the office of the Chief Workforce Advisor. Prior to her appointment by Governor Northam, Megan served with the Virginia Economic Development Partnership and was a 2018 Governor's Fellow in the office of the Chief Workforce Advisor. Megan is a native of Richmond and graduated from the University of Chicago with a Bachelor of Arts degree in public policy. We know that the conversation that we had with Megan last week is just this first of many to come as we work together to create some solutions to help you in your daily operations. I know that the crunch is the tightest we've ever seen it. I want to assure you that we're doing all we can, and all ideas, please bring them forward. Either reach out to Dana or reach out to me so that we can continue to tell your story and advocate on behalf of the people that you serve. With that, I'm going to turn it over to Megan to just brief us on what's happening. And Megan, we know how busy you are, so thank you for taking the time.
Megan, you'll have to unmute yourself.
That was anticlimactic. I see that it says she's unmuted. She must be having trouble with the mic.
It may be a *6, Megan, if you're calling in.
Hello, can you all hear me now?
Yes, yes, welcome.
Perfect. Okay, yeah, I got started talking, but I did have to call in because I'm having I couldn't really hear through the computer. But okay, so now that we've gotten started, yeah, thank you so much, Melissa, for that introduction and for the chance to talk to you all today about this huge, huge issue that, as you mentioned, is front of mind for everyone right now for good reason. Centered around this idea of how we can move workers and employers out of the pandemic, navigate this pretty significant economic shift that is occurring, and move towards, some kind of economic recovery that works for everyone. And we've been in our office with Dr. Healy, the Chief Workforce Advisor, the other Megan. We've been having conversations over the past couple of weeks, extensive conversations with all different business groups and workers, and talking through what this looks like. I think it's very different depending on the region, depending on the industry. And I think what we have been seeing or hearing both in our conversations, but also in what the data is showing us, is exactly as you mentioned, that this is a very nuanced issue and that workers are really going to need a lot of help transitioning back into employment post-pandemic. So we know that a period of unemployment is, it's a serious shock to the system. It can lead to, worse educational outcomes for children, worse health outcomes for the family. It's pretty difficult, and making the transition back to employment can be difficult if you look at sort of the data from previous economic recessions. And so that is even more exacerbated in the pandemic. Obviously, some of the issues you mentioned, childcare, access to transportation, depending on what region you're in, vaccination rates might be different. People might have different perceptions of the safety of being able to return to the workplace. There's a lot at play. And so I say that because I think we need to make sure that whatever strategies we employ to address these workforce shortages, and that is the case at the state level, but also as you all at the local level and employers are engaging with, with members of their community and trying to get people back off the sidelines, whatever strategies we employ really needs to be responsive to people's, the reality of people's situations. So, for example, we saw in the April U.S. jobs report that all of the net job gains went to the male workforce, and it was actually net job loss to the female workforce. So that's a data point that shows us kind of what I'm saying, that we need, we could do a lot of different things, but if it doesn't hit on, access to childcare, someone may want to go back to work, but if they don't have childcare, they're just not going to be able to do that. So we have to think about this in a nuanced way, very strategically. At the same time, employers are struggling, and they've really borne the brunt of the pandemic in the same way that unemployed Virginians have. So we definitely want to move on this and move quickly. So one thing that we are talking about in our office, having conversations about, is this idea of a hiring incentive. And the way that we like to think, it's something that a lot of states are doing. I'm sure you all have seen issuing payments to people to return to work. But the way we like to think about it is it's a potential funding to support someone's transition back into employment. So to help them with childcare, with transportation, or the opportunity to get vaccinated. So nothing has been finalized or announced yet, but just thinking through some of the things that, or kind of talking through some of the things we've been thinking about, I think that is something that a lot of large companies are already doing because they have the resources. You see companies all over the place, from Wawa to, different grocery stores offering hiring bonuses. We've found that it's really our small businesses that are struggling. They have really, like I said, borne the brunt of the pandemic, and so they might not have the resources on hand to help their new hires transition back into employment, even if they want to. So I think whatever program we pursue is probably going to be focused on small businesses, and it would allow, it would issue the funding in such a way that small businesses could kind of, it would go through small businesses, and they could post it on their job application in order to attract workers. So to say, here's funding to help you transition into this new job. and attract people that way. When someone's scrolling through Indeed, they can see that, a small business job posting has some kind of reemployment funds associated with it. I also think that it would really need to be for, what we might loosely call a living wage job. So something that pays probably $15 an hour or more. The reason for that is that, not being able to find a living wage job is a huge barrier to reemployment for a lot of people looking, if the industry they're looking at and they can't find something that they can live on, there's not, as far as a hiring bonus goes, you have to give someone a lot to move them into that type of position. And so I think we get more bang for our buck if we focus on jobs that are living wage. So those are some of our thoughts around what, a hiring incentive in quotations program in Virginia might look like. I'd love to hear your all thoughts on that. Aside from that piece of it, supporting people in their transition to employment, we're moving quickly on a lot of other things to try to help businesses with this immediate need. So the one that I would start with is that we have, beginning this week, reinstated the unemployment insurance work search requirement. So for those of you who aren't familiar, this is a long-standing requirement of the UI program that in order to continue receiving benefits, you need to be making regular contact with employers, certifying that you're completing job applications. If you get an interview, you need to attend. And then if you receive an offer of work that is considered suitable, so it's not 500 miles away, it's near where you live and other things like that, that you have to accept that offer to return to work. Otherwise, you're no longer eligible for benefits. So that's something that was waived during the pandemic because we didn't really want people out looking for jobs when COVID cases were so high. But now that COVID cases have gone down, vaccination rates are going up. Beginning this week, people will have to comply once again with that requirement. And I think it's definitely going to move the needle in the sense that, it's a message to people on unemployment that, it wasn't safe before, it is safe now, businesses are reopening, we're moving forward. This really is the time for you to get back out there and start looking for jobs. So I think even just from a messaging standpoint, that's going to be helpful. Besides the reinstatement of the work search requirement, I also think another useful thing for this group to know is that our workforce system is really mobilizing around this issue and trying to get people back to work. So we have 61 American Job Centers or Career Work Centers across Virginia. Up till this point, they were doing workforce services virtually. Now they have, beginning this week, all opened up to in-person services. And so people can go into those offices, they can get information about what jobs are available, work on their resume. And those offices also have business services teams. So workforce boards across the state that oversee those job centers, they have business services teams that engage with businesses to help them meet their workforce needs. And so I would definitely encourage you all to reach out to your workforce areas, see what kind of services they have available. They're doing already with VRLTA, you mentioned, they've been doing job fairs, regional, sector specific, really getting out into the community and advertising the jobs that are available. And they have a variety of other resources. So if you want to reach out to me and I can make the connection to your local workforce board director, or you can go on the virginiacareerworks.com website and reach out to them. That's definitely a good place to start. And then I think this is a big topic, so stop me if I've talked for too long, but I know, especially in long-term care, we've seen in our office that there have been long-standing healthcare, clinical and non-clinical workforce challenges in long-term care existed long before the pandemic. And so we've always thought about those and been pursuing strategies to kind of combat those challenges as well. And so I think moving forward, there will be some initiatives, especially the governor's Get Skilled, Get a Job, Get Back G3 program that can hopefully move the needle on addressing some of those long-term workforce challenges that might have been exacerbated by the pandemic. So the G3 program makes community college tuition free for low and middle income students that pursue a career in a high demand field, healthcare being one of those. So beginning next week or next month, students will be able to enroll and get free tuition, wraparound supports, and that hopefully will serve as a workforce pipeline that you all and other industries, high demand industries, can rely on moving forward. So I know that was a lot. That's kind of just some of the things that we've been talking about, and I'd be happy to answer any questions about what I mentioned.
Thanks, Megan. Anybody who has questions, you can either enter them in the chat or you can jump on and just go ahead and unmute yourself and ask any questions that you have. Dana, I'll turn it over to you while we see if anybody comes through with a question.
I was going to ask, what does an incentive to go back to work look like? And I say that because when I look at our statistics, 97% of the residents I serve are private pay. And in the last 2 years, our wage growth has been in almost, 10 to 12%. And if that goes to $15 minimum wage, it's going to represent almost a 15 to 17% increase for our residents across the board. So now I'm hearing we got to pay people just to get back to work. It just doesn't sound, it doesn't sound like, Megan, you guys are very in touch. I'm just being honest.
No, that's definitely a fair comment. I appreciate you raising that. I think it is useful to know kind of what the numbers actually look like on the ground. I think the issue is that if we, it's, like I said, you would have to provide, and I would like to say it's less incentivizing people to return to work because people really do want to get back to work. And there's evidence to suggest, some people, it's definitely been a narrative that people want to stay on unemployment, but the data that we've seen suggests that unemployment doesn't have much, the $600 expanded payment last year did not have much of a bearing on whether or not people went back to work. So I think the reason why people aren't going back to work really is because they're struggling with some of those access issues that I mentioned, childcare, transportation, things like that. So that's kind of where the incentive program comes. I think we need a better word for it. It's something to help people transition back into employment after a very lengthy period of unemployment that can be very costly and straining on them. So
but Megan, daycares have been open, and how is transportation different today than it was 2 years ago or a year and a half ago when COVID began? In all honesty, come and talk to our recruiters. They have 50 people who apply online for jobs and 3 people show up for interviews. I literally just walked out of a meeting with our directors of nursing, and they continue to tell me this is the same issue they have. They can't even get people to show up for interviews, but they'll participate online so that they can show they're searching for a job. I'm just telling you what I'm hearing straight from our managers in the front lines.
Yeah, I appreciate that. I think the $15 an hour, if, I would also say that people coming out of the Great Recession, so that we looked at the data in the Great Recession, people came out of the Great Recession making 20% less than they made going into it. Again, a period of unemployment can really have a substantial impact on your ongoing earnings. So I think, if we're talking about low income people, the majority of people that are on unemployment now were making about $14 an hour prior to the pandemic. So in order to make sure that there aren't any significant earnings losses for those individuals, we do kind of need to keep it to $15 an hour. And I would also say that it's different. It's really, really difficult to offer a hiring funding to get you back into work that is enough to incentivize somebody to go into a job that doesn't pay them enough to live. That's kind of our thinking on it. But I will definitely take your comments back to our office, and the reality of that, the jobs they're in your space aren't paying that much, and we'll definitely take that into consideration.
So I've got a report from the Virginia Healthcare Association. Payroll for CNAs, LPNs, and RNs since 2018 have gone up 14.3%. That's a pretty big amount. So it's not like we have not been increasing wages even before the pandemic as an industry. So I agree with your comment that it is a concern. I'm not necessarily even talking about the clinic, the dining staff who may be, at $12, $13 an hour. The clinical positions have already been those salaries have grown at exponential levels. If you truly want to figure out this issue, I'm more than happy because I have tons of data and surveys to help you.
Yes, definitely. Please send any data that you think is helpful to this issue my way. I would love to look at it. Who was that speaking? Also, I didn't catch the name.
Jonathan Cook from Lifespire, Virginia. And I would hope my peers would speak up as well, because the people I've talked to across the spectrum are experiencing the same issues.
I think this might be a really good opportunity. And if there are other questions, you can certainly put those in the chat box. But I really thank you, Megan, for your comments, and hope that you can continue to stay on as we're going to be talking about some of LeadingAge Virginia's ideas that we're planning to submit to the governor's office, as well as some innovative program that we're looking at for temporary nurse aides, a bridge to certified nurse aides. And after talking with you, you know that the governor's office is very supportive in keeping that temporary nurse aide option on the table. So LeadingAge Virginia, we have been behind the scenes working with the other associations to come up with a recommendation for the Office of the Governor to deal with the American Rescue Plan funds that are coming. We understand that over $3 billion is coming to Virginia. There are going to be a lot of people, organizations that will appeal to the administration for their concerns. So we want to make sure that we're proactive and reach you all with our suggested recommendation. So we are working with the Virginia Assisted Living Association, and we have developed a draft that we have shared with the Virginia Healthcare Association for their review and potential sign-on. And to summarize our ask, we are asking that some of these funds be allocated to create a return to work COVID-19 fund to bridge and stabilize the workforce within long-term care. That funding could then be used to assist long-term care employees. For example, a certain amount of funding could be arrived at, for example, $1,500 per employee. And this is just an example, not exactly what we're asking for, but an example of how it could be used, where if there was a return to work COVID-19 fund established for long-term care, that funding could be provided to the employer to then use to incentivize, for example, a sign-on bonus that then could be broken down for what a particular employee may need to get back to work. Could be childcare funds, could be transportation funds. Then some additional part of that $1,500 could be then used as an additional bonus after the employee is employed for 1 year. In addition to that, we are also asking for funding to assist long-term care providers, the entire continuum of aging services, for funding to help them with opening up, rebuilding after COVID, for lack of another term, for a COVID comeback. And that would be a fund that would be broken down for assisted living, adult day, and nursing homes. And that fund would be based on a certain amount per licensed bed. So for example, in our letter, we have suggested $9,000 per licensed assisted living bed in Virginia for an entire fund of approximately over $330 million. We have then suggested a rate of $4,500 for adult day to then be multiplied by the number of that adult days are licensed for in Virginia. We have nursing homes at the bottom. Not that they're not a priority, but nursing homes have received federal funding. And so we do have them in this order, but we would ask for a similar rate per bed in Virginia. So this letter is being circulated with the associations, and once it is final, we will have that before our public policy committee again, and then we'll submit that to the governor's office for consideration. Okay, if there are not any questions on that, I would like to move to the discussion about temporary nurse aides. So temporary nurse aides is a opportunity that the Board of Nursing has published information about. It is a waiver that the governor has permitted in his executive order to allow temporary nurse aides to fill a workforce shortage gap. We understand that there are some of our members that are using temporary nurse aides, which we like to call TNAs. So I am going to hand it over to them to talk a little bit about how they're using them in their community. So I'd like to start with Beth Shalom Village, to Rebecca, and Chanel, over to you. And if they are not able to get off mute, I'll give it over to Estelle with Richfield Living.
Hey, this is Esteban. Can you hear me?
Yes, thank you for joining us, Esteban. Yeah, if you could tell us a little bit about how temporary nurse aides were used in a community that you worked in prior to Richfield.
Yes, thank you. So I wasn't at Richfield at the beginning of the pandemic when this all started. I was at another community, just to clarify that. But I mean, this definitely wasn't the silver bullet that solved all of our problems. I don't think there is such a thing, but it was helpful in the way that we were able to take our existing staff that was not clinical. So the administrator or social worker, anybody else that wasn't certified like that to provide hands-on care. And we made it a requirement to, starting from the top, everybody go through the 8-hour training course. And then therefore, at least on paper, you were able to step in as a CNA and provide direct care. It was a smaller facility, and where we did this in the assisted living, so it was a little bit easier to handle. And it was more than anything part of our emergency staffing plan. So that helped with that question in the survey. One of the questions about what would you do to wipe out your staff? So just an additional bullet point to have that all these positions are also certified or temporary nurse aides. I think it also helped with morale and just tell the CNAs, the workforce that's out there that, when the time comes, we'll be right there with you, shoulder to shoulder. And I think the last point too, it also helped with there's no more excuses, oh, I didn't know what to do to answer the call out. I can't really help. That in previous times before COVID, it was like, oh no, you're not trained to do, you're not supposed to do that. I can't even help with transfers. But during this waiver period of COVID, we were able to help with that. So it was, again, we didn't open it up to hire from the outer community. I know that that's what the TNA, I guess, was intended to do. We didn't feel comfortable doing that, just hiring somebody off the street with no experience to provide direct hands-on. Had it gotten pretty desperate, maybe we would have considered that, but we didn't use it for that reason. So now at this point, what we're looking at, and we'd love to more information maybe from somebody in this group too, is to how do we use it now that it's ongoing to as the bridge program to get our TNAs, the people that have the TNA right now, and would love to continue the path and become a CNA and then maybe a career change. That's where we are now.
Thank you. Thank you so much. Appreciate you sharing. That's very innovative to include in part of a staffing plan. Has Rebecca from Beth Shalom Village joined us? Okay, well, we're gonna move on to our next presenter. So LeadingAge Virginia, we're very excited to announce that we have a temporary nurse aide TNA to CNA bridge program that we are going to be unveiling. And we have Chad here who's going to give us a little bit more information about the program and how your community can get involved in it if interested, and show a little bit of a video clip. And then we have some information about an upcoming webinar on the program. So over to you, Chad.
All right, well, thanks, Dana, and I appreciate it. So I am Chad Shaler, and I'm the Chief Revenue Officer for Cinematic Health Education. And we're a company that was founded before the pandemic. And really, our goal was to bring technology to bear to help combat, the issues in for allied health professionals. The labor shortage, which you guys are talking about, the extreme levels of employee attrition, and then the unique challenges that these frontline workers face. And we started by building a program to train CNAs as part of a greater CNA program. So utilizing the curriculum. And we work with a number of different training providers across Virginia right now. But then when the pandemic set in, Dana, if you don't mind the next slide, we really discovered that, it was a unique unique training needs based on the waiver program that was brought out that introduced TNAs into the system. And, as Esteban was just talking about, temporary nurse aides can be hired in lieu of full CNAs after a simple 8-hour training program. And then, we've worked with a number of different nursing homes across the country where they utilize TNAs in a number of different ways. So, as Esteban said, everyone in his organization went through the training so they could be a TNA. I've seen other groups that have done that. But then as it was initially envisioned, we've seen lots of groups that hired folks off the street. CNA programs were closed, testing ended in most states, or was put on hold, I guess I should say. And so there was a real need to support or to provide more frontline staff. And that's where the TNA came from. But now we're, as thankfully the pandemic is hopefully winding down, we're seeing a need to move those TNAs to full-time CNA status. And each state is looking at this a little bit differently. In Virginia, the facility administrator must deem the TNA competent, and then the TNA needs to sit for the certification exam, which is Pearson VUE in Virginia. Now, what we have found is without proper training, a TNA will not be able to pass that test. They need to have what's traditionally what was taught in a classroom, but they need to have that content knowledge. And that's where, in partnership with LeadingAge Virginia and working with Melissa and Dana, we've come up with a 30-hour program to support those TNAs so that they are able to pass the written portion of the Pearson VUE. So with that, Dana, if you can stop sharing, and then I will share my screen. So what I'm going to do is I'm going to walk you through a little bit of just a very quick snippet of our program to give you a sense of how we approach this. And then, as Dina said, we will be sending out an invitation for a webinar where we can do a deep dive into this on June 15th at 2 p.m. So that said, I am logged in as a student, and what we use a story-based approach to learning with a case study methodology. And what we've done is we have 8 different residents, each with his or her own unique health issues, as well as their specific and unique personalities. And we really focus on not just teaching the content, but also to teach the soft skills that a good CNA has. And we do this by utilizing a movie throughout the program in short episodes that really, one, show what it's like to be and work in a skilled nursing facility, but two, to show how to approach the various personalities that you're going to work with, to teach empathy, compassion, problem solving, conflict resolution, and so on, in addition to the content that they need to have. So I'm going to utilize Helen as an example here. And Helen actually, so she's a resident who has HIV and she has bipolar disease. And what I'm going to do is just very quickly play an episode with Helen, polar bear's disease, and then follow it with how we teach content. So let me play this for you. And I apologize, it may be a little jumpy. That's what happens through Ring Central when you play it. But I will assure you on my end, it's playing just fine. And I say that, now it's not playing. All right, let's see one more time. So my apologies here. Not sure what's going on. Well, technology is always terrific. Let me try something else here.
Well, Chad, while you're trying to get that to work, I just wanted to comment that when Melissa and I watched some of this training, we were really moved about the quality aspect. You could just really see the training promoting quality, just high quality care.
Well, and I appreciate that. So let me try, instead of in the course, let me play you the trailer that really introduces all the cast of characters. And give you a sense of how we approach this.
My name is Marissa. It's my first day.
Ah, yeah. I remember my first day. Hi, Mrs. Graham. I'm the new nursing assistant. You'll do great.
This is the story of Frank.
You know, this place needs a little Frank Grafton. Shake this place up a bit.
And his pregnant daughter, Beth.
We're gonna have a baby.
And Timothy.
Help! Help! We need a nurse!
Whose life changes in an instant. And Lily, an athlete in her prime.
I'm coming for you, Dad. I did the whole trail up to Overlook today.
Whose life is about to change. And Helen, whose grasp on reality is fleeting.
Painting is not an activity. It is art.
And Michelle, who has a reality all her own. Stuart, who's losing the only life he's ever known.
Can I have your radio, Mr.
No!
So
loves her cherry pie.
So I'm sorry, I appear to be having internet problems, and that's what's my issue. It is not Ring Central, so my apologies.
Well, Chad, if a community was interested in having someone trained as a TNA, what would be their first step?
So if you wanted to start with a TNA, we'd have an 8-hour TNA program, which uses this story-based approach that we can make available. And then from there, we have a 30-hour program to bridge to the CNA.
And the cost of the temporary nurse aid program is very reasonable, right?
Yes. So for the TNA program, we charge $45. And then for the bridge program, we charge $325. So if you're thinking about, the typical cost to train a CNA, this is significantly less.
And a TNA that would then bridge to a CNA, would there be any in-person training or would that all be virtual?
It is all virtual. So they need to work in your facility and they will need to learn the skills in order to pass the Pearson VUE. So bed transfers, that sort of thing. So that would, in most cases, that's on the job training. And then our program, which would prepare them for the written part of the test, would be 100% virtual.
Okay, thank you. All right, well, we will go back to the slides now. If there are any questions about TNA, please put those in the chat box, but we will be having an informational webinar about the program on June 15th at 2 o'clock. So if you are interested in doing that and receiving the information, you can send me an email at dana@leadingagevirginia.org, and then we'll also be sending the information out.
Yes, and my apologies for that, for my issues with the internet there.
No, that's okay.
Dana, it's Melissa. I just want to jump in for a second. I realize that this concept, while it is working in other states, has not gotten a lot of traction here in Virginia within our membership. It has more traction, as we understand it, on the for-profit provider side. I know it can create an issue with somebody from a different department wanting to jump over to the nursing side, and then you've got to backfill that position. So we realize that creates challenges. One of the things we're trying to think about is how do we use this as a new pipeline, right, from start to finish. So not necessarily bringing people from other departments, but just a new crop of candidates for your organizations. I realize there is no silver bullet when it comes to solving the workforce challenge. We hear you, I hear you, and we are working on all fronts that we possibly can to help in this area. There's no doubt that we are not the only state that is feeling this. We are not, and that our membership is unique in terms of who you are and who you serve. So I was on a call yesterday with state execs from other parts of the country talking about this. What ideas do they have in their states that we could replicate here in Wisconsin? From Wisconsin, here in Virginia. So I just ask that with your challenges that you're bringing us, we need your good ideas. We need any type of data or research that you are seeing. If you could send it to us so that we can use that data to inform our conversations with legislators, with the governor's office, when we're on task forces and work groups relating to staffing ratios. We are as informed as we can be, but I know that you also have your individual organization story to tell. And so we need that to help inform these discussions. So as we continue to work on these challenges, my ask of you, our members who are on this call, is help us tell the story. Bring us your research, bring us your data, and some of you have done that. We have X amount of open positions, we've had X amount of people apply, and Y amount of people have shown up. But we need as much information on this as possible, especially as we're asking for increased funding. So I just wanted to say that Dana and I are always ready, willing, and able to jump on any call with any of your leadership or any of your teams to understand more about your individual organization's experience so that we can translate that to our elected officials. So thank you for letting me have that moment.
Well, thank you, everyone. Thank you, Melissa, and thank you for being on with us today. Here's my email address. Like Melissa said, please reach out to us with any ideas and things that you have. So thank you so much for being on.